Hey everybody, welcome to my 2-week update on how the eye drops, Atropine, have been improving my symptoms for the eye floaters and just basically my overall experience with them. And I'm going to run through some pros and cons. So, to recap, this is an option for someone who is suffering from floaters and is looking to reduce their visibility of them with perhaps not undergoing a surgical or more invasive treatment for them. And I basically started this, almost 2 weeks ago, and pretty much already have drawn a conclusion about it. But I'm going to continue to use them and will update as needed based on my findings. But I'm going to run through some pretty basic pros and cons and how I feel, and wrap up with kind of a summary of how I'm going to do of how I'm going to proceed for the rest of the year. So right off the bat, pros. When you have these eye drops in, the floaters become much less visible. So I put 3 pros up here, and I'm going to run through them. It basically reduces the visibility of floaters. I mean, that's the whole point of this, right? So we have them, now we don't notice them, we don't see them. It's exactly as I expected. I've had my eyes dilated before when I go into the doctor's office, and it's the same result now. I mean, you can put it in daily, and when I'm walking around, I'm looking around now, I really don't see the floaters, which, to be honest with you, is just a huge relief and improves just my day-to-day functionality. So for those of you out there, maybe like myself, who have been dealing with floaters for a long time and just want to remember what it was like to not have these floaters, well, here's a short-term solution to it. It really improves your overall kind of sense of well-being and certainly your vision. So there's that. Less stress because of it. That's pretty obvious. For everything I just mentioned. I mean, driving, working, everything, a little bit less stressful because I'm not constantly seeing the floaters. Now, what I will say is it's not 100% reduction in notice. I can notice them if it's really bright. I'm in an office right now, so it's not. If I'm outside, it's very bright, I'm not wearing my sunglasses, I will still see them, but not nearly as pronounced as if I'm not using the drops. Third pro, this is non-invasive. I mean, this is not a surgery. This is eye dilation drops that doctors use on patients every day. And there's really not a whole lot of side effects to this. I mean, you're not using laser treatment, you're not having a vitrectomy, which is a surgical removal of the vitreous. That's really the only options that I know, but essentially this is not, for me, the benefits way outweigh the risks in this case, because this is not performing some type of procedure on your eye, it's just applying drops. So overall, pretty positive. Negatives. Few of them. So for one, while it reduces the clarity of your vision in terms of floaters, because your pupil is dilated, especially when you're outdoors, your vision is going to be blurry. You probably know what I'm talking about if you've gone and had your eyes dilated before. It's more difficult to drive, more difficult to see clearly, especially up close. Now, what I will say is this is a low dose use compared to what they do in an office environment, but very noticeable that your eye is not as clear vision, it's blurry. Personally, I'll take that any day over floaters, but you're not seeing 100% clear. Your pupil is very wide now, and it causes blurriness. Fortunately, I'm only using this in one eye because I don't have noticeable floaters in my left anymore. So that makes it very manageable, but I would suggest this is really not something you're going to want to do, certainly for the long term, if you have major floaters in both eyes. I mean, to put these drops in both eyes every day, I don't see that as realistic. Your vision's going to be too blurry, in my opinion. This is not permanent. This is a temporary solution. Day to day, you could do this, but this is not getting rid of the floaters. This is dilating your pupil, which in theory, and I'm seeing works in practice, reduces the reflection, the shadows of the floaters. When the sunlight basically, or any light comes in through your eye, the floaters cast a shadow on the retina, and that's what you're seeing. That's what the floater is. This, by the pupil dilating, this is blocking that reflection, so to speak. But that's all it's doing. It's not removing the floaters, not getting rid of the symptoms. As soon as the dilation wears off, you're back to where you started. There's zero improvement in terms of solving this problem other than this temporary relief. So understand that. I'm sure most of you do, but understand it. This requires a prescription. I got this from a retinal specialist. I talked about that in my last video, but this isn't something you can just go buy. Now, he gave me a 1-year prescription. I imagine you can probably get something similar when you speak with your specialist, but this isn't something that if you watch this video, you can just decide you're going to go do. You need to talk to a licensed professional and get the prescription. For the unknown complications of this, or the long-term complications of this are essentially unknown. I don't plan on taking this for forever. I'm not anticipating this being a long-term solution where I'll really come into facing a long-term complication, but we don't really, I mean, this has been prescribed by a retinal specialist who knows what they're doing and said that it's safe. But I have not tested this long-term. I'm going to continue to be evaluated if I have a specialist say, hey, you need to stop this, it's doing something. Absolutely, I'm going to do that. And I'm just basically making the point that I don't think this sort of treatment option has been around long term that we can say for sure this is a great long-term move. And I certainly wouldn't be saying that until I use it long term, which I don't plan on even doing anyway. So just know that. Going back to the visibility of it, one other con that I want to mention is that it really dilates your pupil. I'm going to zoom into, you might not be able to tell, but basically your pupils are very uneven, obviously. You're doing one, not the other. So it's noticeable. And I look in the mirror, I notice it. You know, my wife could notice it. You could really, if you're engaging with people face to face, they're going to tell that one pupil is larger than the other. Whether or not that bothers you is up to you, but it's part of why this is not a permanent solution. I mean, it's very clear that your pupil is dilated. If you're meeting with someone up close, that may be important to you to want to avoid. It's something that's going to happen every time you use these drops, so understand that. It's not something I would advocate doing on a first date, for example. So extrapolate from that what you will. But this is something that, unlike a vitrectomy or unlike laser surgery, it would be noticed outwardly, whereas typically floater treatment, you're the only one that's noticing it is you. In conclusion, this is something that I would recommend for someone to consider if they really want temporary relief, but not as a long-term solution. It's something that I'm going to continue to use for the next few weeks, likely months, just to give myself that daily relief, because I tell you, it's a great feeling. But if anything, it's only encouraged me more to consider the vitrectomy repeat surgery on my right eye, because now I'm reminded about just how great it is to be floater-free. And that's ultimately what or as best I can, remove as many of the floaters as possible through the vitrectomy, is really my ultimate goal, and not just this temporary solution. Because I tell you, walking around with this, it's just a great feeling, and I want to experience that on a more permanent basis. So that's really my takeaway from it. We'll post another video probably in a couple of months as I have updates, but I wanted to give this in more real time so everyone knows that this is something that so far has been working well for me, and I'm quite pleased with it. Take care.